Good afternoon, and thanks for joining us for the Variant and Vaccine Straight Talk, what to say and how to say it. For those who may be new, my name is Holly Foxworth. I'm a registered nurse here at Axiom. I'm also the marketing manager for content. I'm joined by a fantastic panel today, some of the brightest minds in not only medicine, but also health management. And so we will introduce them shortly. Before we get to that, I did want to just kind of mention several things before we get to announcements, just kind of in an honest disclosure here. Whenever we came up with this topic and we kind of planned these in advance, we were in the very early stages of recognizing that we could have a potential problem on our hands in terms of the vaccination rates that were going down. Obviously now, as we come to you and speak about it today, we realize that we've got a major issue that's on our hands here. We're in dangerous territory, and we have to look at what's going on with the Delta variant. So it's going to take a lot of effort. It's going to take some education, and it's going to take some action to really get this turned around. So I genuinely, and I know our team does as well, appreciate you joining in and being committed to joining forces here and getting information out to the people that need it the most so that we can not only take care of ourselves, but also take care of each other. So moving on then to the quick announcements before we get moving, we do have lots of free resources that are located there in the resource tab. That's the one that looks like books. I've included a ton of things actually this week. So we've got everything from best practice white papers. We've got all the information about how to start a vaccine program. We've got information about if you need testing programs as the cases are going up, check into work, you name it, it's all there. So please feel free to utilize that and share that with anybody that you think could be of use as well. So please don't hesitate to utilize any of those resources. The other thing I was going to mention was the questions. So we're going to cover a lot of questions that we've been receiving, but any questions that you have throughout the event or comments that you want to share, please just type those into the Q&A box there at the bottom of your screen, and we will cover those either during the event or right before we close. And the last thing I wanted to mention is that while we realize we're kind of having to make a U-turn here and return to some of the COVID focus, we also recognize that we can't lose sight of the day-to-day things that happen with safety and health in the workplace. So this next week, or actually it'll be 2 weeks from, I believe it's on the 22nd, I think that's right, 22nd at 1:00 p.m. Is going to be our next event, and it's specifically about the truth behind sprain strains and are your employees fit for duty. And I'll tell you that whenever I was looking at some of this information and just kind of looking at the numbers, you know, we use a lot of those, the large, big, we love to say billions and, you know, all of these huge numbers that come along with it. I think it's like 171 billion is what they put out that we're spending annually on some of these work-related injuries. But it dawned on me that maybe we're looking at this the wrong way. Maybe we are calloused by some of these huge numbers. And what would it matter? Would it make a difference if we started looking at it on a per case basis? If we looked at it and said, okay, the average now is $42,000 per medically consulted injury. If I asked you to write out a check for $42,000 for a sprain strain injury that occurred there at the workplace, I can assure you it would get my attention. I think it would probably get yours as well. So we've got a great guest that's going to be coming in. He is the founder and of one of the partners that we utilize. He has some great ideas in terms of not only prevention, but also management of some of these sprain strain injuries. And I know that this will be probably one of the most valuable hours that you will spend in your health, safety, or risk management career and listening to what he has to share. So if you haven't already, please click that button, the register now. You don't have to enter any additional information, and that's going to be for the truth behind sprain strains and are your employees fit for duty. So I think that wraps up the majority of the announcement we wanted to cover there. Let's go ahead and just kind of move forward and introduce some of our safety heroes. Dr. Cherry, you want to kick us off?
Sure. Good afternoon, everyone. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I am board certified in preventive medicine, public health, and occupational environmental medicine. I've been supporting either the military, corporate, or industrial operations for the past 15 years. And of course, we've been really heavily involved with COVID for the past, well, since the pandemic, which is, I don't know, is it 18 months now? I probably don't even track it, but it's a pleasure to be with you today, and thank you.
Absolutely. Dr. Curtay, let's go to you next.
Sure. So I'm Les Courtier. I'm a clinical psychologist. That's where my board is. My background is primarily in health psychology and workplace behavioral health. And it only feels like it's been forever. And the last 18 months. So
You're exactly right. Yeah. And Dara?
Thank you, Holly. My name is Dara Wheeler. I'm Axiom's Chief Marketing Officer. I've been with Axiom for 15 years, and I'm really passionate about trying to support employers as they are trying to weed through employee health and safety. And this is an important topic. And like Holly said, we're pivoting a little bit back to talking more about COVID, although it is an important topic. It is keeping health and safety of our employee workforces at front and center. So thank you, Holly.
Absolutely. Well, we can go ahead and just kind of jump in, just kind of give you an idea of what it is that we're going to cover here today. So we're going to talk about not only where we stand with the Delta variant and some of these cases, but also how the management of this may be a little bit different, what it is that you need to do in your own workplaces, and then most importantly, how it is that you need to have these conversations so that you can educate others, and that's how we'll protect each other. So Dr. Cherry, I'll come to you first. If you want to kind of just talk us through where we stand and what's going on with the numbers that we're seeing in this upward trend pattern here.
Yeah, I'd like to orient the audience to kind of the blue graph here. And this is really the epidemic curve of the pandemic since the beginning. And so if you think back to March, April, May of 2020, when the world was really trying to understand what was happening, that was that first very small wave or curve there, maybe about 40,000 cases per day in the U.S. And then in the summertime, we had a large surge that was basically double that at about 80,000. And then really a massive surge in the winter of 2020. I kind of think of it as one mountain, but there's actually three small peaks. And I've just kind of thought through it as kind of Thanksgiving, Christmas, and New Year's that are kind of exciters across a big surge anyway. And you're talking about, 300,000 cases a day here in the U.S. And then fortunately, we came down quite significantly, looks like really in January. And so because of, maybe seasonality, vaccines coming on board, just natural immunity, things like that, things were coming down, to the point where the CDC was really relaxing a lot of the requirements as things were continuing to get better and better. And then in the summertime here, we saw really the lowest time ever of infections, and this was really pre-Delta. But then we started noticing about 6 to 8 weeks ago, we started to see another inflection point, which was a little bit concerning, watching what was happening in India. And then in the UK, we were starting to brace for our most protective postures for our own internal protocols for our clients. And we've continued to see this consistent, very aggressive acceleration of cases. And so right now, if we compare to about 6 weeks ago, the country is probably 10 to 15x where we were at. And so that's quite concerning. If we look at the UK, they ultimately went about 23 times as high as their baseline from about their lull in the summertime. And so they're still kind of holding at a fairly high level of cases. And so this really speaks to we need to prepare for and renew our energies about COVID protection in the workplace, in the public, in our own lives. And so, I think I'll stop it there, Holly, and let me know if you'd like me to address anything else.
Yeah, no, I completely agree. And maybe I'll kind of pivot to Dara here. We also track some of those numbers. Dara, do you want to talk us through what that first graph reflects there?
Yeah, happy to. So we actually are tracking internally, these are cases, COVID-related cases that we manage for our clients. And you can see that we're starting to see a pretty significant trend up. So although that's not representative of the U.S. total population, that's a fair representation of our clients that are having us manage cases. And I think Monday was an anomaly with a pretty huge spike, but of course there's some other underlying components to this, but we are seeing a major trend up in case volume as we are coming into this, especially regionally, which I think is a takeaway that we hear from a lot of epidemiologists and infectious disease docs, that as we cycle through COVID, there will be a lot of regional considerations, especially as you look at vaccination rates and behaviors and adoptions of different behaviors. And so we need to be, as employers, thinking very carefully about protecting those people in those regions and how we put something in place to mitigate that risk. So it's we'll talk a little bit more about that, but it is something that us as an organization are seeing. We are seeing a major increase inbound of cases.
Absolutely.
One thing I'll just add real quickly, Holly, is our internal trend line is a little bit more flat than the general public, and that's because of a number of differences. One, this is an employee-based population, and so our clients are much more protective than probably the general public. And then our the full multi-layered approach really has a significant benefit in a controlled setting, in this employed setting. And so when I've done analysis for some of our clients to show kind of infections in their workplace compared to maybe the local region that they're operating in, we usually see a major reduction of, 1/5 the infection rate, 1/3 the infection rate. So that kind of explains why, although the cases are still going up internally, it's not at that same aggressive acceleration, but it's definitely something to be mindful of, because every infection for our client is potentially operating limiting. And so we really try to strive for, zero infections in the workplace.
Excellent point. Yeah. And the other thing I was going to ask was, if you could kind of just review that, because it seems like that there's a little bit of confusion here about the COVID that we were initially prepared for and had learned about, but then all of a sudden now we feel like that, there's a lot of questions. We're all of a sudden getting these questions about how could, I've been vaccinated, but yet we're hearing that people could be positive again, this, that, and the other. Could you maybe just kind of go through some of the facts there that are specific to this variant and what we're working with here?
Yeah, and I think there's been a lot of variants in the news, but I think practically we can just think of 3 variants. There was the original strain, the wild type they call it, and then there was an alpha variant, which was kind of the dominant variant for quite a while. But now it's Delta, which was, I think, originally discovered in India and moved to the UK pretty quickly. But essentially, every variant that you hear about is, it essentially means this virus actually is much more capable, efficient than the previous variant. It's really a competition between all the different variants, and there's actually probably many variants created during the life cycle of viruses when they're replicating. Many of them actually make them less efficient and then they die off quickly. But if there's one that actually confers a significant degree of competitive advantage, then it actually becomes the dominant strain. So I think probably 2 months ago, at least half of the infections in the U.S. were Delta, and now probably 90% of infections are Delta. It's just a much more effective virus to infect. So I think the previous variant was twice as more contagious as the wild type, and now Delta is twice as more infectious as the previous variant. And what we are seeing is more severe illness in those that are unvaccinated. And so then unvaccinated people are at the greatest risk for severe disease. And we are seeing breakthrough infections in those that are vaccinated. And so this maybe take a couple of a minute or so here to discuss that, because I think the average person, when they hear about getting vaccinated, they automatically feel that, okay, I'm 100% protected about being infected, and they kind of just, leave it at that. But there's kind of two categories of vaccines or infections that are addressed by vaccines. So a lot of vaccines, once you're fully vaccinated, then you essentially have no risk of infection, and they call that sterilizing immunity. So it's a very clean way to look at it. But there's a number of infections that you don't have 100% sterilizing immunity. You basically have a fair amount of immunity for infection, but the goal of vaccination is actually severe disease prevention. And the classic infectious disease that we think of is influenza. And so, flu shots have been out there annually for decades. And when I was in the clinic, I would advise my patients, the reason you get a flu shot isn't to prevent flu, but it's to prevent dying from flu. And so it really significantly reduces your risk for severe disease. And so, for one, we're seeing infections with Delta variant in those that are vaccinated, but usually they have a much higher or a much lower severity rate. So when you look at hospitalizations right now, over 95% of people that are hospitalized for COVID are from the unvaccinated proportion of the U.S. And so that's a very strong statistic that can show the benefit of vaccination. So, if you are in the vulnerable populations that the CDC has published about, you should really strongly consider getting the vaccine. And I'll leave it at that. Yeah.
Yeah. And speaking about the hospitalizations as well, I'm sure you guys saw it on the news as well. I think they were saying, wasn't it, Arkansas last night was saying that they had like 8 ICU beds left in the entire state that were available at that point. So you're definitely seeing a strain on some of these resources. Do you feel like that we'll see that trend continue in some of the other states as well, Dr. Cherry?
Yeah, that surprised me. I think when our hospital systems are overwhelmed, that's when governors and city officials really need to step in to prevent kind of a mass casualty of not just COVID cases, but of anything else that you need to go into the emergency room for or to be hospitalized for. People are still having traumatic accidents or heart attacks, stroke. And so once a system is overloaded, then it shifts the whole triage curve really in a bad way. And so, that news did surprise me. I have been looking at hospitalizations in some of our other key cities and states, and we are starting to see things get much more full, but seeing Arkansas almost at full capacity was quite alarming.
Yeah, I agree. I agree completely. Yeah. Let's talk about masks a little bit. This has been a hot topic, obviously, and there's a lot of strong opinions in both directions. But it looks like that we've had some new guidance that's came out in terms of what the CDC is recommending. Can you talk us through that?
Yes, and I think part of the campaign to promote vaccination obviously came with benefits of being vaccinated. And so obviously one of them was not being masked in some public areas and things like that. And now that there's some more evidence or some studies that show about breakthrough infections in those that are vaccinated, albeit usually they're not linking to having to be hospitalized or death. still there is potential to spread in vaccinated versus unvaccinated. In fact, a couple of studies have shown, which is actually tough for me to reconcile, but I do believe the studies that the viral load in vaccinated and unvaccinated persons when they're infected are actually very similar. And so technically, although the infection may be in the mucosa of the respiratory system, where maybe they're not getting a systemic infection and then needing hospitalization, at the level of the nose, the mouth, the upper respiratory pathways, you're seeing equivalent viral loads. And more importantly, with Delta infection, we're seeing hundreds or even thousands times higher viral loads than the previous variant. So this is, again, a much higher, much more highly infectious variant. And so it's really a no-brainer to kind of re-implement the masks for close contact, indoors, things like that. I even recommend N95 masks for clients that are really trying to go to as protective as possible because of this high infectiousness.
Good points. Yeah. Dara, let's go over to you, because I always you do such a great job on explaining sometimes the layered approach, but talk us through why this still matters and why it's still relevant to what we're going through right now, whether that be in a workplace, whether that is in a school environment with our children that can't be vaccinated yet, et cetera.
Yeah, thank you. And I actually saw one of our listeners out there asked a similar question, why we see lower rates in our employers that we work with. And I think this is a great example of that. So when we started supporting employers at the beginning of the pandemic, we all know we didn't have tests available. We didn't have vaccines available. So in some ways, we kind of went old-fashioned and went to a syndromic screening and some other layers that are here, like environmental cleanings and case management, which is our CREA process, and PPE and daily health attestations, contact tracing, isolation. All those early protocols were really effective, and we still maintain that they were very effective. So although we now have testing that's much more widely available and vaccinations, which are supporting the process of trying to keep as many people out of the hospital system as possible, we do see those as kind of the top two layers. The rest of them still need to be in place. And we've seen a lot of our clients going back to conservative measures and making sure those layers are very much in place. And the way we describe it, we've got these stacked layers here. And a lot of the docs we work with call it the Swiss cheese effect as well. And the best you can do is put these layers in place, and they don't approach zero risk. There is no way to get to a place where you're 100% covered and at zero risk. But what this does is it puts those layers and stacks them so that if you do have a miss in one, it doesn't cause an outbreak. And that's one of the reasons that we've seen a much lower infection rate in our employers that we work with, and reductions in outbreaks and shutdowns, which for any business continuity is critical. And so the minute you shut down or have an outbreak, that takes away from being productive and being successful in a business. And that could be a business like the media production space we're in, where every day that you shut down a production costs an enormous amount of money, or a plant that if you shut down, they're not producing the things they need to be producing. So there's all sorts of reasons that these layers are there. And testing and vaccines are two components of those layers, but you have to have them all. You can't have testing and vaccinations without, and this doesn't even take into account, good policy and process, which should be probably our first layer. We need to make sure that we have a policy in place and we have good processes in place. And a lot of employers at the beginning of last year didn't really feel prepared for something like this. And now we've had 18 months of experience, and they still don't feel all that prepared for this, because it's changing, it's drastically changing. But if you've got some good process and policy in place, then that helps settle the noise a little bit and gets everybody back to thinking, okay, we know how to do this. We know how to keep people healthy and safe in the workplace. And I'm sure we can talk a lot more about that as well. Anything I missed,
Yeah.
Holly?
Well, the other component I was just thinking about now, and we didn't put it on the slides, but was just that concept of being flexible, the flexibility and risk leveling, and I was thinking back, I personally had gone on a vacation last week. I went on a cruise. And so while we were there, there was an announcement that was made that there was a family that had been isolated. Everybody was vaccinated. One had very minor symptoms. They did contact tracing. All of the family was positive. They immediately isolated them, and then we removed them from the ship, et cetera. But it all goes back to that process of that you have plans in place, that you know what's going on, you know how it is that you're going to manage things, and that you have everybody's on the same page, and that you can add or remove the various different interventions that kind of come along with that. And I would assume the same concept would be true in business, healthcare, anything else like that.
Agreed.
Let's see. All right. Well, let's talk about then some of the exposure best practices, because there is a ton of confusion about this on how it is, what you're supposed to do if we're getting exposures. Are we going back to the original policies, or do we need to isolate if they were already vaccinated? Does that matter, et cetera? So I think that this is going to be a hot topic that we're going to need to not only educate ourselves on, but also educate our employees and the general public about. So, Dr. Cherry, do you want to start? And Dara, feel free to jump in as well.
Yeah, I think the way to think about it broadly is there's people that are potentially infected or presumed infected or infected with a positive test, and then those are people that are exposed. So they're not technically sick yet or testing positive, but they've been exposed based on some kind of criteria of contact tracing. And so the CDC has guidelines based on how long someone is technically infectious from when they begin. And so when someone's infected, there's some studies that have shown once 10 days have passed, unless they have severe disease and have been hospitalized. So if it's just kind of a typical case that's not hospitalized, once 10 days have passed since their symptoms began or testing positive, then they can discontinue social isolation. For those that are exposed, you actually have to wait longer than if you were sick. And it's very counterintuitive, but because the incubation period for COVID-19 is up to 14 days, we actually have people out longer for being exposed, but not even sick. And so that's been a tough one early on to try to convey to our clients. The CDC has put out guidance probably a year ago now, once testing was available, that you could test asymptomatic exposures at 3 to 5 days and kind of allow that person to come out of isolation as well. And that needs to be kind of a risk-based discussion because, the full incubation period is 14 days. The average incubation period is 5 days. So 50% will convert if they're going into infection by day 5. And so there's kind of an unknown what happens at day 6, 7, 8. I think 97% of infections convert by day 11. So if there's like a human capital planning, mission critical, something happening in a certain area, you can use different timelines to test people back in if you have a critical shortage of employees. So basically, the other component is high-risk populations that, whether they're unvaccinated, immunocompromised, try to really manage their risk with as highest protection levels as possible, even with potentially an N95 versus just a regular face mask or no mask at all. Still continue with social distancing, contact tracing. I'm actually interested to see if there's going to be some changes to these recommendations because we may actually see, the current contact tracing guidelines are contact trace anyone that's within 6 feet for a cumulative of 15 minutes to someone that's a confirmed case. But because Delta is much more infectious, we may see that distance change to further away, or the time greatly reduced just because of the infectiousness. And then really just continue to create that culture of health and wellness that Dara was basically alluding to, or specifically addressing with that multi-layered approach.
Good information. And I noticed in the comments that came through right here, it caught my attention that Brian was asking, do these points apply to both vaccinated and unvaccinated?
Yes. Our Axiom standard, which we take in all the different guidances out there by the World Health Organization, CDC, and other agencies. But usually we're actually much more protective, because we'll look at studies that potentially the CDC will, one, there's a different scope. For one, the CDC is advising on the general public, where we're actually advising our clients who are running a business. So they're under higher scrutiny by potentially OSHA under the General Duty Clause to protect their employees, and just really for reputation and preservation of continuity of operations. Some states have very low thresholds for infections before they're shut down or need mass testing of their employees. And so we've always held the line. We've never treated vaccinated differently from unvaccinated. And that came from some of the early, when the vaccines were first issued emergency use authorization, they did not document infection prevention. They only documented severe disease prevention. And so we took the most conservative approach as possible.
Mm-hmm. And I think Joanne had also asked about testing recommendations, whether, what was asking, how often should they be testing, and would that be different for if you had a completely vaccinated population versus unvaccinated?
Oh, that's interesting. So actually it still applies, because we actually see a significant number of breakthrough infections. In fact, the CDC's own early release from their morbidity and mortality weekly report, I guess it was 2 Fridays ago now, there was an outbreak of nearly 500 infections. And actually the majority of infections were in vaccinated people. 79% of infections were in vaccinated people. And so I think more research needs to go into that as a hypothesis generating result from that study. But practically for our clients, we do not recommend any difference. And so, you can obviously test people for medical surveillance, just as some type of focus on making sure you're not missing an outbreak that's brewing in your workforce. And I usually will give guidance to our employees about some type of statistical modeling of how to do that. But I think their question was really, do you treat vaccinated and unvaccinated differently for testing? And I would say no. Okay,
good information. Let's go over then to actually kind of covering the top 5 that we see most frequently of the evidence-based variant questions that are coming up, and that, you as an employer may be asked by an employee. Maybe you can kind of give us some ideas. So the first one is, how do I know that vaccines are safe? How would you recommend that they answer that?
So I think broadly they are safe. From a population health level, there's been, hundreds of millions of doses given. There are safety reports that are issued, but they're quite rare. And so I think at a high level, the vaccines are safe, but every individual needs to do their due diligence to see if it's right for them. And so I think that's how you have that nuanced conversation. And so I do think the FDA is looking to actually issue full approval soon, but that's still pending. And that may help some people feel more comfortable. But, I think when an employer is talking about a medical topic, I think it's to give education, resources, but also empower their employees, encourage them to seek their own personal counsel there,
Absolutely. All right. The next one that we get a lot is, if the vaccines work, why are vaccinated people getting reinfected and some without having any symptoms?
Yeah, so what happens with a lot of the the breakthrough infections is it'll be a local infection, and so you'll have virus infecting the upper airways of the nose and the mouth. But because the vaccine really is creating antibodies that's working through the blood, it prevents kind of this systemic infection that ends up requiring hospitalization. But yeah, you are seeing a fair amount of breakthrough infections. And just like what I spoke to earlier, certain infectious diseases are just not amenable to what we call sterilizing immunity. I was still optimistic that potentially COVID would potentially be a sterilizing, one of those infectious diseases that we can get sterilizing immunity. But it looks like at this point with the current vaccines, that's not the case. And I think I answered that one all the way. Yeah.
Yeah, definitely. The next one was, how long do vaccines work and will I need to get a booster?
Mm-hmm. So it looks like there's a range of there's an estimate of range of how well it works. So I think it ranges between like 3 months and probably 9 months. I think even one of the pharmaceutical companies, Pfizer, or one of them have stated that probably 8 months for them. But there is probably a waning effect. So at 3 months is probably when you have the strongest antibody and maybe even T-cell immunity response, which is kind of another whole component of our immunity that usually isn't talked about largely. But it does look like there's really not complete immunity, and with the rate of mutation, there most likely would need to have some sort of booster probably in the future.
Yeah. And I think I saw on the news where they had announced, was it last night, that the FDA was saying that some of those that are immunocompromised, that they would be candidates for that third dose, correct?
Yeah. So usually when I think of a booster, you can think of it two ways. I'm not sure how I always think about boosters, but there's a booster that's just the same virus that kind of just it boosts your immunity to the same antigens, the same infectious agents. But there's also, when we talk about boosters for COVID, because of variants, it could be a booster that has a new target of the infection that's based on the new variant.
Okay. All right. 2 more, and then we're going to move on to Dr. Curtay, that's going to share his magic and tell us how to brilliantly speak about everything. The next one was, is the Johnson & Johnson vaccine less effective? And should I get another vaccination for extra protection if I had the Johnson & Johnson vaccine?
Yeah, I think like strong studies on this topic aren't out there yet, but I do think there's some early data that shows like the Johnson & Johnson, which is the virus vector type of vaccine, is probably less effective than the messenger RNA ones. So I think they're potentially estimating in the mid-60s efficacy, where potentially the messenger RNAs are in the mid to high 80s. So that's the first part of it. But the second question, the U.S. has really not advocated for mixing and matching vaccines. So getting like 1 dose of one messenger RNA and then maybe a second dose of another messenger RNA, or maybe the Johnson & Johnson, which is not a messenger RNA. But the U.S. really has taken a stance to not mix and match at all right now, and to not get a second vaccine series. So I actually, I'm interested in this topic, and I think it's a hot topic because a lot of the world is doing something potentially like that. But right now in the U.S., that's really not our standard practice.
All right. And then the last one, are the symptoms any different for the Delta variant, and will there be more variants other than Delta?
Mm-hmm. You know, there's some little tweaks to the symptoms, like, you know, the infamous like loss of taste and smell seems to be less apparent for Delta. But I think what's been so challenging with COVID-19 in general, regardless of the variant, is it's really hard. You can't wait symptoms to be predictive of COVID. In fact, I would almost say the most common symptom is no symptoms at all, which is very frustrating from a clinical perspective. So, you know, a lot of people think they just get allergies and then it ends up being COVID. It's very challenging. So I would not hang your hat on waiting symptoms for prediction.
Okay. And then just to verify, so you're saying, though, that there could be additional variants that could follow this after Delta, correct?
Yeah, I think there's already a few variants of interest, Lambda and maybe one other. They're using the Greek alphabet now. Oh, Iota. And
Iota, yeah.
Probably, I don't know if I said that right either. So I know that's my first. Les, was that right? I don't know. But
Epsilon is out there already.
Yeah,
but not yet in the U.S. as far as I know.
Okay. And did I say that right? I don't know if Iota is the right pronunciation, but anyway, I was hoping to peer check that before. But yeah, there's several variants out there, and that's really the nature of coronaviruses, sadly, in general.
Good information. All right, Dr. Curte, you are up next. So we are in dire need of your skills and your magical words that are going to help everybody know how to explain things, what they need to say, what's going to matter, what's going to turn them on, turn them off, etc. Talk to us about how it is that you have some of these
pressure.
Yeah, no pressure. No pressure at all.
Yeah, no pressure. Well, you know, I think first I've been kind of thinking about as I've been listening, I've been thinking about what makes it so hard to communicate about this. And I think that if we start there, I think that's probably a great place to start for what to do. You know, the first thing is just what we get used to. You know, if you look at the curve way back in the very beginning, if what's going on right now had been happening a year ago, we would have been horrified.
You're right.
But now, you know, well, it's another blip. Mm-hmm. We don't know how high the blip's going. But, you know, even when we got back to baseline after the big winter peak, when we got back to baseline, if that had been happening, you know, back in the beginning, we would have been absolutely horrified. Mm-hmm. So we kind of get used to things, and then we start, you know, it's really hard to wrap your mind around feeling a sense of urgency around something that has become almost commonplace. So I think that's one thing that's happening, is a certain level of complacency that goes on. And, you know, the longer it goes on, frankly, the more people that you know who've gotten sick and didn't end up in the hospital, didn't die. And so maybe it's not such a big deal. You know, we human beings are very protective of themselves. We don't like things that are ambiguous. We don't like things that are terrifying, that we can't explain. So we will look for excuses to not scare ourselves. That makes perfect sense. And that's exactly the problem here, is that we have to communicate simultaneously a real sense of urgency. And at the same time, if we are trying to scare people who aren't scarable anymore, then they're going to just tune us out, right?
Right.
And I think that's kind of where we are, is figuring out how to have those conversations. And so that's the first thing, is I think it's really important for us to communicate this really is urgent, right? There's a lot of infection going on. Obviously, a lot of those people who are infected are not going to end up in the hospital. They're not going to die, partly because it's spreading among the vaccinated, and those people aren't getting for the most part, it happens, but it's unusual. They aren't getting so sick. But the fact of the matter is that hospitalizations and deaths follow infections. And so as this spike goes up, it's really a significant issue. I almost think we've done ourselves a disservice right now also by calling it an epidemic of the unvaccinated. It's always been an epidemic of the unvaccinated. It's just that now there are different pathways to being unvaccinated, right? In the very beginning, it was an epidemic of the unvaccinated because nobody was vaccinated. Then people started beginning to avail themselves of that. And so the first people who got sick were people who had chosen not to take a vaccine or they weren't eligible yet. So all of that dynamic is starting to change. We just have to acknowledge all of those factors. And that's, when people are hesitant, when they don't know what to do, that first point, 2 ears and 1 mouth. I think the first thing we have to do is just listen to why are people hesitant? What's the concern? And I see people on both sides of the spectrum. I see people who, refuse to take any kind of precautions. And on the other side, I see people who are still completely isolating themselves and staying away from everybody. Mm-hmm. Probably neither of those extremes at this point is totally appropriate. And certainly it's not appropriate everywhere. But I think that we need to be willing to understand what somebody's questions are. And unfortunately, I think, we tend to sort of dismiss people who don't have our same perspective.
You're right.
And honestly, it's really easy to listen to people who agree with you.
Yeah.
The skill is in listening to people who don't agree with you and not overreacting. And so I think that's a really important thing. And for employers to be willing to listen to what their employees are saying is huge. I mean, it has everything to do with how much you trust what you hear. All of these points are really interwoven into we have to be willing to talk to one another and to listen to what's going on. And all of that being said, at the end of the day, you also have to take a position that's consistent with public health. Right. So I'm really happy to listen to anybody who has, and what their concerns are and encourage them to find out things for themselves. That was one thing that Scott, you said early on, that we encourage people to find, to get information and to understand the risks for themselves. Mm-hmm. And for me, the only thing I would add to that is that means talking to health professionals and not Dr. Google.
Oh, good point. Yeah, good point.
Because you don't know. The problem is that everybody has access to all kinds of information. The problem is we don't know enough to sort it out. So you need to find people that you can trust who can help you sort it out. But at the end of the day, after all of that listening, you still have to have policies in place that keep people safe. Mm-hmm. And I think that's going to differ for, different employees in different settings are going to have different requirements. An example, I'm an adjunct at the university, and the university instituted a full-time mask requirement because I'm in a very high transmission area. Mm-hmm. So, you can't pick and choose in that kind of environment. If I were someplace where the level of vaccination was different, the infection rates were different, the positivity rates were different. Maybe they'd come up with maybe a different policy would be appropriate. Mm-hmm. So, that's somewhere where, somebody like Dr. Cherry, the folks at Axiom can kind of help with figuring out what those right policies are. But you need a policy, and you need to adhere to it. Mm-hmm. I think that's the last message. Listen first, but know what your policy is, and at a certain point, you just have to say, "This is how it's going to be because I'm going to keep my workplace safe."
So. Great information. Absolutely. I know we're running short on time, and we've got lots of good questions that came in, so we may not go through each of these that are here. But I did want to just kind of address some of the misinformation. I think that really kind of is one of the worst weapons that we're up against at the moment. Is some of the myths that we hear, and not being able to give people the correct information that's going to be right for them and their individual circumstance. So some of these that are here, is there anything that any of the three of you, have picked up on this list here that we haven't already covered, or just really jump out that you feel like that we need to address? And
I just wanted to say, Holly put together a webinar a few weeks ago with Dr. Matos and Dr. Cherry about myths associated with the vaccine and coronavirus. And I find myself personally referring family members and friends to that discussion a lot. And it's a little bit long. It's about a 45-minute video, but I definitely recommend, if you haven't watched that, watching it if you are concerned about some of these myths and how to address them. I think we will start reposting that with some shorter components, because it is a very long 45-minute video. And so taking maybe myth by myth or concern by concern, let's start having these conversations. But one of the things, just as a general note, and I think Dr. Kurte said this really well, but humans, even if there's facts presented, we still have feelings. And arguing facts with people that are anxious and stressed and emotional, and the best of us are right now. So it doesn't really matter what the facts are. And that's part of the issue around communication, is that making sure we're listening, but also just understanding that just because you keep throwing facts at people doesn't mean that they're going to internalize that at all. So, again, I could keep throwing this video out there and making people watch it and sit them down to watch it. But with the amount of stress and anxiety that we're all experiencing right now, they may just not be able to hear it. So having some empathy and having those conversations and continuing to be supportive is really the way to keep this progressing. But as an employer, facts and feelings and emotions, it doesn't matter. You need to have policy, and you need to have process, and you need to be able to kind of point back to that with some empathy. Of course, empathy should lead you in everything you do at an organization, but it's important to have some framework to point to that takes a little bit of that emotion away from the discussion, and gets people thinking about how do we protect the greater team here, to Les's point. So that was my soapbox about these.
No,
You're exactly.
Yeah. What I see a lot is, people say the same facts, only louder, which has the exact opposite effect, right?
All caps.
You're right.
Yeah, all caps facts.
All caps, yeah.
And it doesn't help.
You're right. Yeah. We're right here at the end of time, but I did see several good questions that came through, and just to kind of clear some of these that are here and give you some quick information. Brian and Lane, you guys had asked about where you could get that video. We will make sure I believe it's on YouTube as well, along with our social channels, but we will post that again. And maybe actually you should get maybe a follow-up email after this event. And so I will make sure that we also put a link to that in the follow-up email that you get, so that you have multiple places where you can access that. Let's see, was there anything else? Let's see, one other thing caught my attention here. Dare, was there other ones that you saw that came through here that we didn't catch? The very end. Oh,
yeah, I think I saw a couple of questions out there about incentivizing vaccinations and having that conversation and what we've seen work. And it's really dependent upon your organization and your population on how to approach it. And it really is that risk-based approach as an organization, what level of risk you are able to manage and what level of risk your populations have, how close they are to the public, how close they are to each other physically. There's all sorts of things to weigh. We've seen a lot of success with organizations that are incentivizing vaccine, but also that are taking the initiative to have vaccine events. So I know the news captures this all the time, but we are seeing a lot of success with organizations that are making it easy. They're bringing vaccines to the people. They're making it super simple. And they're making it something where they don't have to take a day off of work or manage that. And they're also being very supportive of somebody who's going through vaccine symptoms. There are a few, minor symptoms. And so they've got, again, back to policy, they've got great policy and process in place. They've got case management processes to help an employee work through that process of getting vaccinated. Holly, we've got a lot of questions about tests too. And I know that we've talked a lot about tests and kind of the efficacy of different types of tests and whether we've got, these at-home kits with CVS, what the differences are between tests. That could be a whole other webinar. So we can definitely support you. If you have any questions about testing, we can help you kind of weed through all of that. And there's some tests are really great if you're symptomatic or if you're not. So it just a lot of times depends on the scenario.
Mm-hmm. I did see one more thing that was here from Cameron that was asking about, has OSHA redacted their statement for vaccine and work comp and it being a recordable for adverse reaction to the vaccines? Dr. Cherry, is there anything that you could maybe kind of share about that?
I don't know, actually. I might actually look that up just to kind of get up to speed on that.
Yeah, I haven't seen anything that's came across my path where I've noticed that there were some changes there as far as I know, but we definitely will take a closer look. Just kind of closing here. What I will say is that obviously this is a big conversation. Unfortunately, we're in the wrong direction of where we hope that we would be, but I think that we'll put together some bite-sized content that we'll put on social media and other different communication mediums there that will get you the resources that you need that you can share with your employees, that will get them what the facts are and how it is that you can best manage this. I mean, it's a group effort. It's going to take all of us working together to really be able to make a difference here. So any closing remarks from the three of you there that we haven't already discussed?
I'd just like to reiterate what Dr. Curte was saying about it's the facts, but it's also the emotion. I continue to just be actually very enlightened by how temperament really affects all of our lives with regard to there's those 5 personality traits. But I think that this topic speaks to someone's risk tolerance and openness to new things. And it's really some people just are so easy to, I used to ride motorcycles. I didn't think once about it for 20 years. And now I don't ride motorcycles anymore. So I made a choice, right? But I think, we're struggling as a large population to get a collective in agreement when we have so many different temperaments out there with regard to those characteristics. So it's really a tough one. So I'll leave it at that. Yeah.
Yeah, good information. All right, anything else? Dr. Curte, did you
I'll underline something. Yeah, I'll underline something that Dara said about making it easy. I mean, that's just a principle of getting people to participate in health behaviors. We can experimentally demonstrate that if you make something 15 seconds easier, people are twice as likely to do it.
Oh, good point.
Setting out your gym clothes the night before is the classic example. You do that and you're twice as likely to actually exercise in the morning. It's very simple. So that's one thing you can, that employers can do that, isn't about resistance. It isn't about anything. It's just make it easy. Make it easy for people to do the right thing, and that's consistent with your policy, and it's more likely to happen. So
absolutely. Derek, anything else that you wanted to close with? Yeah.
No, all well said. And again, we could probably spend another hour talking about this. I know there's a lot of unanswered questions out there, so please reach out. We're happy to help, and we'll reach out individually to those of you that didn't get your questions answered. So thank you.
Absolutely. Absolutely. Yes, we will reach out. We'll also include the link to that video, and we'll also get you some updated information as those numbers are changing as well. So if you haven't already, please don't forget to click on the register now, and we will see you in 2 weeks. Thank you and have a good day.